Everyone, good afternoon. This is Rebecca Clyde, and I am one of the members of the HIMSS Arizona Chapter Education Committee. It's good to have you all here today. I'm really excited about our webinar for today and presenting our amazing speakers and topic for hospital at home, extension and quality of care at the patient's home. Before we get started, we just have a few announcements we'd like to make. As always, all of this programming is made possible through the incredible contributions and participation of our sponsors. So thank you, Pivot Point Consulting, CDW, NetApp, Nutanix, AP Professionals, Nuance, MassTech, SentinelOne. We really appreciate your support and all of the contributions you make to our success here at the HIMSS Arizona chapter. Just to give a quick rundown on why we're here. We are a professional association for healthcare informaticists originally, but I've seen that because now technology is everywhere, I've noticed just a really wonderful participation across many different service lines and business lines within the healthcare industry. So you'll have representations even from startups, from health technology companies, and healthcare providers, all talking about the importance of continuous improvement in hospital management systems. So thank you all for your professional contributions to our chapter. The reason HIMSS was created was to realize the full potential of every human everywhere. And our mission is to reform the global health ecosystem through the power of information and technology. I'll turn it over now to our esteemed panelists and our moderator today. So Tina Burbine, would you like to introduce your panelists today? And I'll hand it over to you now.
Yeah, thanks so much, Rebecca. Really appreciate that. I'm Tina Burbine, VP of Care Innovation for HealthLink Advisors and serving as your moderator today. And really appreciate Dr. Anderson, Mark, and Jasmine being with us for this discussion. Let's start with introductions, including the organization you're with and the type of role that you serve. Dr. Anderson, why don't you begin?
Yeah, hi, thanks, Tina. I'm Matt Anderson. I'm a physician at Honor Health here in Arizona. I work as our Chief Medical Information Officer for our ambulatory space, so I help cover all of the informatics, technology, and virtual care in the outpatient world here at Honor Health. And I'm very excited to share what we've been doing and learn from the rest of the group.
Awesome. Mark Schumacher, I'm the Vice Chair of User Experience at Mayo Clinic, also based in Arizona, but working for Mayo Clinic nationally. I head up the Experience Design Team in Mayo Clinic's Center for Digital Health. And that is our digital product creation department, where we're building everything from our patient portal to our different web and web apps to chat bots to AI and data initiatives and machine learning and robotics. So really excited to be here.
And thank you so much for moderating everything, Tina. My name is Jasmine Bhatti. I'm a registered nurse, and I'm the founder and CEO of Navi Nurses. So I realized both as a caregiver of a loved one, as well as being a nurse, that there's a lot of unmet needs that we have for people, specifically in their homes. And so what Navi Nurses does is we now connect the ordinary person to expert registered nurses who can provide on-demand care that meets their specific and personalized needs. So really excited to be here and join the discussion, and looking forward to it.
Yeah, thanks so much. Appreciate those great introductions. I am honored to be joining the three of you here today. And this discussion about, this intersection we're at between virtual care and care at home and all of the growth in the market that we've seen, not just in the past few years, but it's actually projected to continue with about an anticipated $265 billion worth of care services in the Medicare fee-for-service, Medicare Advantage patients that are all going to move into virtual and at-home care by 2025. So it's more important than ever that we're really thinking about how our virtual care programs and our care at home pathways are connected to serve patients in the best way possible. So today we're excited to talk about, what's working well, where those challenges are that still exist, and the lessons learned from these three really important local organizations in our Arizona market, both from Mayo, Honor Health, and NAVA Nurses. So we really appreciate all of you that have joined us today. Please feel free to submit questions via the chat feature. I'll be looking out for that throughout today's discussion. We want you to definitely feel like you're a part of this. To kick us off, let's start talking about, with Mark's help, really what the Center of Digital Health is focused on over the next year or so, and really how they're working to ensure virtual care and care at home are collaborative more than ever. Mark?
Yeah, thanks, Tina. At Mayo Clinic, the needs of the patient come first. And, one of our most important things when addressing the virtual care space, whether it's, at home or virtual visits, is making sure that you have an overarching virtual care strategy and that all of your virtual solutions align to the larger patient journey. It's usually a thing that's overlooked when creating and adding spot solutions and digital experiences and products to the patient's ecosystem, is ensuring that all of the products and different steps throughout the patient journey are aligned. When you're creating these virtual care experiences at home, it's easy to be in this environment where you're doing spot solutions, where you're buying white labeled products or buying from vendors. And that can be a great solution for when you're trying to provide care at home or virtual care to your patients. But it's often that you forget that it's part of this larger journey for the patient, but also the clinician. And you can end up in situations where your experiences are conflicting, and that can come down to everything from like messaging, dialogue, tone, instructions, or even brand. And you can also run into issues on the clinician employee side too, because of the fact that when you put these spot solutions in or virtual care experiences into the patient journey, you're also putting it into the clinician journey. And it's really important to make sure that you understand that clinician or employee digital burden by these experiences being introduced. Sometimes you think that what you're doing is, adding an experience that is helping clinicians, but sometimes you're bringing in a 15th browser tab, or you're adding this entire new process for how a clinician or an employee might work. So it's really important that as you're adding all of these solutions, you make sure that you align to your overarching strategy when it comes to virtual care, so that things are cohesive and plugged into each other.
I love that. How do you know, Mark, when your team's working on something, whether you should, wrestle with this age-old question, build or buy, right? Because you mentioned, maybe considering white labeling something, but of course, you also covered a few things that your team's developing. So how do you and your team address that?
Yeah, it's really important because of the fact that what might be the cheapest or fastest solution might you encounter problems down the road, like I mentioned with the patient journey on the clinician side, but also there's things about identity, data storage that can really run into issues. And also you can create this environment that from a data and technology perspective is so inclusive that you have a tough time getting information out of it, right? Like I mentioned with patient identity, how do you make sure that the patient identity is flowing through the patient journey? But then also when you get to this buy solution that you decide to plug in, can that actual buy solution, does it have the capable APIs for identity and integration if that's needed? Or also data. You want to make sure that these point solutions that can often be exciting and really crucial accelerators to your practice, that they don't end up being a place where the actual experience stops or the data stops flowing.
Definitely. I think throughout what you were describing, you kept using the word seamless and really patient-centric type of thinking. And so, Jasmine, knowing that your team is focused on serving patients in the home, what are some, would you like to expand on the types of experience that you're really aiming for to tack on what Mark has shared so far?
Sure, I'd love to be able to do that. And probably a little secret too, I came from Mayo Clinic as a nurse. And so that philosophy of the patient needs come first, like that's very much ingrained in me and who I am now as an entrepreneur and building a startup. And so that philosophy is very central to what we're doing. And it truly is how are we supporting them? I'm coming from a position of having left the bedside, building a startup. And so we've kind of had to prove a model using things that exist. So it's kind of, we started in that buy mode of let's buy what's already working and then tailor that to what people need. And so we're doing the discovery sessions right now, talking to clients to really learn about what's working on their side, what do they really enjoy, what do they need and want. And we get to do that at the same time with our nurses. So hopefully we can build something that is important for everybody, because I think what we just heard was that it's got to be good for both the clinicians as well as the people that we're caring for. And we've got to find ways to communicate, what's happening in a way that, as a nurse or as a physician like Dr. Anderson, that our patients can actually understand and take that information from them. So I think that what we're seeing is we know that more than 50% of the people leave the hospital, they don't even have access to home health, like they don't qualify for it, but that doesn't mean that they don't need it. And so that's the other gap that I know I'm seeing more than anything, is that we underestimate how much care people really need. And sometimes we support them, we give them these technologies and tell them what to do, but it's hard for them to access sometimes, or they don't quite understand the value of how that fits into them. And maybe that's because we need to do a better job of making that value more apparent to them, or integrating more seamlessly into their entire care experience, not just this one episode, but how does it all link together? And even more so, how does that link together with the family? So we also find that bringing in the family, the other care team, like that's so important to people, and really providing holistic care is so much more than just us and the services that we're providing to people.
Yes, I remember you shared with me not that long ago, this example we were talking about patients and how it really feels to go through the discharge process, and how we're all very accustomed to having a discharge nurse that's going to interact with that patient and, supply some instructions, and, there are expected follow-up appointments, et cetera, for somebody. But it's really hard as a patient to be dealing with, the healing process and position that your body is in, and at the same time absorbing everything you're being told and the stacks of paperwork that are provided to get you home. And that individual may not have the home health support, even though they may need it, like you just mentioned. So that, combined with this concept of digital burden that really impacts not just our patients, but also our clinicians, I think are absolutely, on the top of everyone's mind as we think about continuing to scale this type of care. So Dr. Anderson, I would love for you to jump in and share your perspective and the different things that you deal with your teams as well.
Yeah, absolutely. Here at Honor Health, like many systems, we are dealing with that transition in virtual and digital healthcare that, for a while during the pandemic, that's what we had to do because that's all we had. We had telemedicine. And now we don't just have that. And we are getting back to more normalcy. The majority of all of our outpatient appointments are all in person now. And it's fantastic for our clinicians, it's fantastic for our patients, but we've really gotten to the point where people are very, very comfortable using some of these digital technologies. We've increased our patient portal use and patient portal access. We've get them comfortable with doing video and doing video from the home. We've been able to meet patients where they are. I can't tell you, I still do a shift in telemedicine every week. How many people are in their car when they have their appointment? And I have to always make sure, please, are you pulled over to the side of the road? Those are things we didn't have to worry about a couple of years ago. Meeting people where they are with their technology. Not everybody. We were just talking about. I'm using my old school wired headphones today. Just to make sure that they work. Where we have to have those things. And I think we've made such good progress. And now as we start to think about what virtual technologies are going to move us forward, it's much more targeted. It's less of we got to take care of everybody virtually to who can we take care of virtually the best? Who is going to be able to receive the best care, whose best care is not in a clinical facility, and how can we make sure that we don't increase that digital burden that you talked about? I think the perfect example is the patient portal. It was really easy to ramp up our use of patient portal, and that has been a great thing for our patients who can now schedule online and who can get refills and talk to their clinicians. But it also does create sort of an on-demand 24/7 expectation that your clinicians are going to get back to you right away, just like a text message or an email. And that is something that we've had to really focus on and help not only train our clinicians on how to use the portal and what's appropriate responses and when to do this, but also our patients as well, because there has to be some boundaries there in terms of how we communicate. So I think that's one area where we didn't really expect. We always thought, hey, portal usage is going to be great. It's going to decrease messages. We can send your lab results electronically, but now labs come in to the patient before sometimes your clinician has even seen them. Because of how fast things turn around and how we have to release them. So, just getting back into the habit of educating our patients, educating our clinicians, and then, just thinking about how we target specific either patient populations or specific disease states, I think has been really important. Being able to offer video-based care to those video-capable patients whenever they need. As a way to increase access to our health system. If you can't see your regular doctor and you don't want to wait for what you need and you don't want to go to an urgent care, we have video options for you. Our specialty is not immune to this. Our outpatient specialists, we've developed quite a few programs to help do some asynchronous consultations between clinicians and between patients, so that we can really know and prioritize our specialty referral queues, which has been really a very positive thing for both patients who either don't need to end up going to a specialist and don't need to spend that copay and that time. And then we make more space for the patients who really need to get in front of those specialists, into that cardiologist, into that neurologist and rheumatologist. So it's been pretty, that part's been pretty fantastic. So really thinking about much more targeted, much more pinpointed strategies, kind of like Mark was talking a little bit about being able to have an all-encompassing sort of platform. But we're really focused on using that same platform in multiple small slices, and I think that's been a key to some of our success recently.
I appreciate that, Dr. Anderson. Mark, as I was listening to Dr. Anderson talk about, of course, some of those data challenges that I think every team is facing. Would you like to expand on something that I think you mentioned earlier, the identity and epic pools and all of the comments you made earlier? I think that would definitely be worth diving a little deeper into.
Yeah, I think it's really important to figure out how that identity starts to scale across these journeys, and what that means to the patient, right? I think there's this assumption that, and it happens a lot in healthcare, and it's kind of happens to, in healthcare across the board, is that people have the assumption that healthcare is going to work just like all the other digital experiences throughout their life, right? And they should, right? Because so many other industries have kind of raised that threshold of digital competence and experiences, whether it's, banking or Netflix, or kind of, hopping in a ride share, or, comparable experience. It'd be like using an airline, using the Delta or American Airline app, right? Where their identity follows them through all these things. And then they hop in healthcare, whether it's these virtual care experiences or hopping on the portal, and they start to realize that things aren't connected, right? And I think from a user experience perspective, it's really important to kind of set the expectation with the patient, so that if these systems and the data and the identity is not being shared throughout them, right, which is really hard to do in healthcare, we all know the challenges that come with all of those things, that we put the user first, and we actually explain to them, we make sure that we have the appropriate dialogue to guide them through these things, so that we're anticipating the experience that we're kind of plugging into their journey. I think often we kind of forget about that, and we slot something in, and we forget all the things that happened beforehand and all the things that are happening to the patient right afterwards.
Yeah, I love the analogy, that Amazon experience. I think it's something we've been talking a lot about and trying to create in healthcare. But Mark, to your point, it's complicated, and it's not something that we can just make happen overnight.
Right.
There are so many data challenges and integration to create that more seamless experience. Yeah. Jasmine, would you like? Oh, please.
Oh no, I sorry about that. I was just going to say, I think that that's where it's really important to make sure that we're being clear with the patient as to what is about to happen. So.
Yeah, absolutely. Jasmine, how do you feel about, when you think about our patients' data experience, some of the comments that Mark and Dr. Anderson have shared, and how that fits into some of the things that I think your team sees regularly, like the disparities from a patient experience perspective?
Sure. Well, first, I kind of want to tag on to what Mark was just saying and highlight the fact that we still use fax machines and pagers. And that's a problem. Like, even for us, as we intake clients to our service, like, I still have to go off of pagers and faxes to intake them into what we're doing, because we don't use a large system like Epic or Cerner. We're a smaller system, so it's a little out of our reach for right now. But that makes things really complicated. And sometimes what the biggest problem is that people can't really articulate what's happening with themselves. Like, they don't understand enough to be able to relay that back over in general. And particularly when we look at discharging from the hospital, that's like the most fragile point of a patient experience, because they've just gone through something. They may be on medications. They're probably sleep deprived. And they're overwhelmed, they're stressed. And then we hand them a packet of papers in black and white. It's like 50 pages long, and expect them to be able to digest all of this and know what to do next. And so, just like what Mark said, like, having clarity of what is to come ahead. And that's where I think we have a great opportunity for improvement, is helping them understand what does that plan look like, and taking that 50 pages of discharge paperwork and putting into something that's meaningful and useful for them, so that they can actually care for themselves the best that they can. We also see, some of the biggest challenges are, when people have healthcare across different systems, that's really hard too, to try to coordinate and get everyone talking on the same page. And one of my nurse mentors does research out of, she's the East Coast. And when she finds that when a nurse calls to make appointments, that people get in to see their primary care and their specialists faster. Like, that's really interesting. But why is that? How can we do that better to make sure that people who just had a hospital admission, they have like some priority over, like, how are they getting back in to make sure that this doesn't happen again? And so there are a lot of issues related to just like the fragmented nature of healthcare, but there are the disparities as well. So I incorrectly assumed as a nurse that everyone who leaves, when they go home with home health, they all get the same thing, right? Like everyone will have the same experience. But unfortunately, our healthcare system is also influenced heavily by the payers who are able to allocate the services that we provide. And so I think that's a significant part of the dialogue, because that influences the care we're able to give. And how people are able to actually recover well. So I think not including them in the dialogue is just, eliminating a big part of the problem here.
It's interesting that you mentioned that, because I was just having a conversation with someone yesterday about some virtual opportunities for post-hospital work. And so not only are they leaving the hospital, like you said, with that giant package and maybe some home health and maybe this and that, but they're probably leaving sooner than they would have several years ago, because length of stay is such a big issue. So they're leaving probably sicker than they would have before. And we're going to be shifting some of that time that they would be recovering in the hospital to home. And so some of that nursing burden, some of that care burden is just going to be shifting to people who are completely non-clinical, family members, friends. And that's where entrepreneurs and digital health can really make a huge impact in educating, training, maintaining, being able to track, giving a little bit of support to these new caregivers who are, taking care of a loved one. So I think it's fascinating.
Yeah.
I've seen an uptick with teams starting to use the teledischarge process a little bit more, especially in the last year. And it's so fascinating to watch that, I call it the data story, that comes back to really highlight, what's working well within that process and what's challenging. And the thing that we have continued to see or find is that, one, you're not getting the same type of one-on-one interaction as a patient. And two, it's very difficult, depending on the physicians that you have within an acute facility, to standardize the way that your discharge processes happen, because according to each physician and that relationship they have with the patient, there are many, many nuances that provider physician may want to ensure that patient has as well. So it's just interesting to see that there may be some efficiencies gained by using the teledischarge process in some instances, but that doesn't necessarily mean that it's going to work across the board. And I think this gets back to what you were saying, Dr. Anderson, that, as we're looking at integrating, very focused areas of, digital solutions to make a difference, we have to be very selective with what, where and when those are going to be used so that they're effective also. When we think about all of this activity across the board that we are continuing to try and address on behalf of our patients, I always feel like it's so helpful to talk about lessons learned, the types of things that we're running into, and the things that we should be talking about to help our peers around us. And so it's in that spirit that, would love to dive into some of the things that each of you are running into. Mark, would you like to expand on maybe that build or buy conversation that might be happening a little more regularly in your digital strategy planning?
Yeah, it's a topic that comes up all the time when it comes to virtual care and care at home, and it happens regardless of your clinic or institution size, right? No place is going to build everything, but it's really important that, and I touched on this a little bit earlier, the capabilities of the products, the third-party products that you're going to bring into your ecosystem. There's a lot out there, and I don't need to name names, but it's really important to make sure that you truly understand the connectivity of those things, a little bit beyond, well, our product has an SDK, truly digging into it and going like, what are those APIs that are available? And I touched on this earlier as well. How can that make sure that the data is flowing freely through these experiences, and we can actually connect it to the larger digital experience for our patients and clinicians? But another part of it too is just when you're going in and starting to address these virtual care solutions, make sure that you have a virtual care strategy and that the product you're going to buy potentially does not become your strategy, right? And that you just don't depend on that for the entire experience, that you have a larger digital strategy and that you're picking one or many solutions to add to it, but they don't define the experience and the strategy for your organization.
Yeah, I love that. I hear a lot of times the teams say, well, it's got Fire integration, we're fine.
Yeah.
That doesn't give you the full data story, right?
Nope, it really doesn't.
Yeah, absolutely. Jasmine, from your perspective, what types of lessons learned come to mind from the last year, and are the types of things that the team's continuing to stay focused on for the year ahead?
Sure. So speaking as a nurse, right? This is my heart and what I do. So I think no matter what solutions we provide, keeping the person at the very center is really important. And I think there's a lot of healthcare changes that people are seeing around us in the media. They're seeing nurses going on strike and not understanding why there's staffing shortages and what's happening and what does that mean for them. And so I think just we've got to be focused on creating a culture of trust that people can feel safe and comfortable with their care. And with virtual care, I think about what Dr. Anderson was saying, we've got to bridge it somehow because we are sending people home sicker sooner, and they're going home with more drains and more complexities, and we're going to rely on their family to help care for them more with a higher level of training that, like, I went to school to know how to do, and we're just expecting a normal person to all of a sudden just know how to do in a few days. And so there's got to be a good combination of how do we combine this amazing technology and then combine that still with like the compassion and the trusting relationships that we build as human beings with one another. And hopefully in doing so, we're able to ensure that people have the very best healthcare outcomes possible, that we're keeping the burnout low on nurses and physicians who are leaving the profession at really alarming rates. And so we've got to be able to make sure that we're quick enough, we're helping to solve these problems for both clinicians as well as patients. That's just really important, I think, just moving forward.
Yeah, absolutely agree. Dr. Anderson, what about you?
Well, I think the things that we focus on kind of come from those lessons learned. I think we see issues with access across the board, regardless. From my own sort of work, it's all in the outpatient world, so it's across the board for primary care and specialty care. How can we use the same footprint, the same number of clinicians, the same buildings, but see more people, take care of more of a population? Can we add in asynchronous work? I kind of mentioned some of our asynchronous consultations, but how can we get patients care outside of normal business hours? So not everybody can make it to the office between 8 and 5 Monday through Friday. It's not possible for a lot of people. How can we make care available to them, again, without burdening all of our clinicians? How can we get them care at 10 p.m. or 8 a.m. on a Sunday? And we're working on some of that with some of our asynchronous care. And I think that's really important, to be able to allow the same number of clinicians to take care of a larger number of patients in more creative and virtual ways. We just don't have enough. We don't have enough physicians. We don't have enough advanced practitioners, NPs, PAs, RNs, LPNs. We don't have enough of everything. And so we need to be able to figure out how we can be just much more efficient and still keeping the patient-centered mentality, maintaining our empathy in that space. So, and then, kind of go along with that is, again, we can't keep asking our clinicians and our staff to do more. Right? We just can't keep asking them to do more and more and more. There was a time where that's what we had to do because of the pandemic and what was going on, but we need to be able to allow them the grace to recover too. And so being able to fight that digital burden, I was talking with a group of physicians yesterday, and they talked about the portal wars that they have, and I hadn't heard that. I was like, "What are you guys talking about?" It's like when you get into a back and a forth with a patient over their portal about when you need to actually seek care and when they can deliver care over a portal. They talk about going back and forth, 20, 30 times sometimes with a patient, and we need to have ways to help them understand those things and take care of those patients in a better way, so that they're not, using not only their time but also their mental energy. It takes time. So we continue to work on trying to find avenues for everyone where we can meet them where they are. We're not going to have one solution, kind of like Mark was saying earlier. We're not going to have one solution for everything, but we can use the same tools to target specific types of patients and to solve specific types of clinician problems. And I think that's really, that continues to be our focus moving forward.
Yeah, I think through all of this, Dr. Anderson, I hope you don't mind me sharing that, in addition to something that I say is, we got to pull the rocks out of our clinician and provider backpacks, right, to make their lives as easy as we can. And then also we need to be, I feel like there's this trend to be mindful of just how tough it is to be a front end clinician and physician dealing with the types of things that you just described. And in fact, there is definitely, I think, more of a focus more than ever before on creating wellness programs internally for our front end workers, to encourage them to continue being part of the team, because it isn't easy, and as we bring in more digital solutions, it does present a different set of challenges for them, and really working through different ways to try to, alleviate that digital burden. I love that phrase that the three of you are referencing today.
It really is. I mean, wellness is so critical to what we do. We cannot have well patients if we don't have well RNs and MDs and DOs and NPs. We just can't. I think that's really important. And I think part of wellness too is figuring out where some of these boundaries are. A lot of this stuff is new. We haven't done a lot of this work before, and so much of how we started in a shotgun style because of the pandemic. So what Jasmine's doing, what Mark is doing, these are things that just there's not a playbook for. So we still need to be able to set up some of those digital boundaries, so it's okay. For our clinicians and RNs in the hospital, we kind of know that, like, hey, your shift ends or your time ends. When we have like resident physicians, where's work hour restrictions, like this is where it ends, and you have some time to recover. And we're still working on that in some of this virtual work.
Yeah. I am grateful that it felt like for a while there, we were all just going to continue working at what I call pandemic speed.
Yeah.
And it feels like these days, we're starting to tilt back more towards exactly what you just described. And it's great to see. In our last few minutes, I do want to take the time to go, I call it around the table, and share, a last few words of wisdom. Mark, would you like to start?
Yeah, it's an interesting question, the words of wisdom. And I think I'll answer that by, if anyone is thinking about implementing a virtual experience into the patient and clinician's journey, think about virtual as a capability as opposed to a solution. Because I think often people get stuck in the virtual part of it, and they forget that whether it's a video visit or it's care at home, or you're going to an actual facility and meeting with a clinician, it's all the same journey. It's just you're picking a channel. So those would be my words of wisdom.
Love it. Jasmine?
Yeah, I think from my perspective, just the fact that we're all here together, right, talking about this. I think the dialogue is really important, continuing the conversation, but then collaborating together, like what does work? How do we move the needle forward together as just separate siloed organizations? Like, how can we do that together? And I think we'll be very effective, and we can learn a lot more and be disruptive, a little bit more disruptive, quicker, if we can just learn from each other and learn with each other quicker. So I just really look forward to that, because I think here in Arizona, we're really lucky. We've got just an incredible environment, and I think everyone's just friendly and helpful. And I think we'll be able to hopefully set the stage for how we can influence our peers even across the nation.
Yeah, absolutely. Dr. Anderson, any last words of wisdom?
I just take risks, right? That's the number one thing that I think is where we should be. We need to take very calculated risks. Healthcare is messy, right? We talked a little bit about the Amazon model. Like, if I get the wrong book, I can just send it back. If I get the wrong medication, there's a more serious outcome there. But being able to take those risks, to push the envelope, to try it, we don't do that often enough. We're a very conservative field, medicine. I think being able to take those calculated risks is the most important thing. If you provide great care and it's not really that efficient, you can stop it. As long as you're providing that great care, keeping the clinician and the staff in mind, try different things. You're going to find things that work and some things that don't work, but you're going to learn either way.
Yeah, absolutely agree. Love that. I appreciate those words of wisdoms very much. I think that, it's just helpful for, as Jasmine mentioned, to continue having these types of conversations and really collaborating more closely together. We are just about out of time. So Rebecca, I would love to leave the last 5 minutes and hand it back over to you so you can close out with some messaging for our chapter members. And actually, if it might be that Rebecca's having some audio issues, so I will provide a quick thank you to our sponsors again on behalf of the Arizona chapter, and of course to the 3 of our panelists for being here today. I know all of you carry very busy schedules, and thank you so much for taking the time. I know our members appreciate it. For those who haven't seen this yet from the chapter, board voting has opened, and we would love for you to cast your vote. If you go back through your inbox, you should see a few messages about that with the voting link to use, and look for more messages coming soon. I believe voting is open for another 2.5 weeks. Thank you for joining. This video recorded link will be circulated through our newsletter and be posted on our Arizona HIMSS website. Thank you again so much for being here with us today, and look for more information soon about our next event on the Arizona HIMSS chapter website. Have a great afternoon, everyone.
Thank you, Tina.
Thank you.
Thanks all. Great conversation.
Yep.